Hey guys, this is Lorenz of the Ketones and Coffee Podcast. Make sure to subscribe down below so you don't miss out on any of this great content or health. I'm so excited for this. We have a very special guest on the podcast today. Dr. Valerie Franc is a highly respected naturopathic doctor with over 20 years of clinical experience. She is a graduate of the Canadian College of Naturopathic Medicine and has a certification in naturopathic medical education, along with additional trainings in hypnosis, acupuncture, and traditional Asian medicine. As the owner of a private family practice in Toronto, her extensive experience in naturopathic nutrition and sports nutrition, Dr. Val has been awarded the Leo-Boucher Award for Excellence in Clinical Nutrition. In addition to her private practice, Dr. Val has taught at the Canadian College of Naturopathic Medicine and the Canadian School of Natural Nutrition. I'm so excited for this. I'm here with Dr. Valerie Franc. Dr. Val, welcome to the show.
Thank you so much. I am so glad to be here and definitely love any opportunity to share knowledge, and just love what you are doing in terms of your podcast too, getting out to the world about health and nutrition, because there's so many misunderstandings out there.
Awesome, Dr. Val, and it's an honor to have you on here. So, funny story on how I met Dr. Val is I was at the awesome event called the E-Circle Immersion in Toronto, run by amazing Nikki Ballou and Teresa Dugwell and the rest of the E-Circle Academy crew. Let me tell you, I learned so much about how to become a better health coach and to always lead with my heart. So shout out to E-Circle. Anyways, Dr. Val was one of the presenters that day, and let me tell you, like, Nikki introduced her like a boss, and her delivery was so good, and she totally nailed it. And as an aspiring health coach myself, I was taking notes like a madman, and was totally blown away with her, presentation skills and her delivery, and everything was on point and super easy to understand. And so after that day, I knew I had to get you on the show today, Dr. Val, and the rest is history. So here we are, finally getting to chat. One of the most phenomenal experts, health experts out there. I'm so excited to have you on, Dr. Val.
Thank you so much. And I couldn't agree more about the shout out to Nikki and Teresa. They are amazing human beings, and very, very prominent in my journey as well.
Love your story, Dr. Val, because it's all about finding your own path to wellness. And I love the subject of, and I believe that food is medicine, healing our bodies naturally. And I avoid prescription drugs whenever possible. Anyways, and so, Dr. Val, our listeners would love to know what brought you to where you are today. If you can share some of the key moments or experiences that shaped your journey and led you to focus on nutrition and your current practice.
Sure. And as I look back and kind of reflect on that story, one of the things that strikes me is that you start out in life and you think you know something and you have no idea. And it's always like it's this journey of one step leading to the next, and things kind of unfolding in a way that you didn't necessarily expect, but then it's so joyful and rewarding. And I say that because, my journey started out, actually, I was taking a marine biology course at the University of Guelph. Loved that university, and I thought I was going to be a marine biologist. And then it just wasn't for me. And so I started taking these classes, kind of trying to figure out what I loved. And I took a nutrition class and fell in love with nutrition. So I switched to nutritional sciences and was actually I was studying animal nutrition and nutrition in general. And I thought, I'd love to still work with animals. Didn't think I'd be working with people at that point in time. I love animals. And so throughout my journey, I had graduated with this undergraduate degree. I was going to apply for a master's, PhD, and go on to do more research. And then I got sick, and I was sleeping. I'd be asleep for 10, 12 hours. I'd be up for an hour, and then I'd have to go back to bed. And I thought, I can't live life like this. So I went to see my medical doctor, and she was phenomenal. She's a wonderful human being, did everything that she could. She did every possible test she could think of, and then probably more that I didn't even know existed at the time. And she just said, listen, everything's come back normal. You're perfectly healthy. This is just stress. Go sleep some more. I was like, how can you sleep more than you're sleeping? That's how can you live like that? You can't. That would be a coma. I would require intravenous medication. Like you can't. So on the advice of my aunt had kind of said, hey, well, listen, if you don't have any answers, why don't you go see my naturopath, because he's amazing. And at that point in time, I thought, I don't have anything else to lose. I don't know where else to go. I can't live like this, so why not? So I went to see the naturopath, and the first thing he says to me is, well, this is your diet. And I'm like, what do you mean this is my diet? How could this possibly be my diet? I'm a nutritionist. I know everything, right? I had graduated at that point in time. And sure enough, we did some testing and found out I had different food sensitivities. And basically I was sensitive to life. And so I'm like, okay, I can drink water, I can breathe air, that's about it. And after I finished crying a little bit, then he kind of said, hey, well, let's just change these foods. So I found that when I was able to change those foods, my health turned around just like that. It was just so amazing. And so I started to just become healthier and more vibrant. And I got my energy, focus, and concentration back, and shed inflammation. So my weight dropped. I wasn't overweight, but my weight dropped because of the inflammation that I lost. So at that point in time, then I was hooked. I was like, okay, naturopaths have secrets, because they knew what my doctor didn't know. And if I was in an undergraduate degree in nutrition, why was I never taught any of this? Why was I never taught this was a possibility? So I was like, okay, I want your secret knowledge. So then it just became about a quest for knowledge. And that's kind of where my journey started. And I went to the naturopathic college, got out in practice, and then as I was practicing, realized, wait a minute, there's a whole other component here. And then there was this component of that mind, body, spirit piece that I became really curious about. So that's when I started to train in hypnosis. That's where I started to learn yoga and trained in Ayurvedic medicine. And then that's where I decided to go as well to China. And really, I studied there at a teaching hospital. I immersed myself in the culture there to find out and to study, okay, what do you know about acupuncture, about herbs, about other forms of medicine, about just foods in general from that different perspective. So I got all of that learning and just spent a lot of time and a lot of years just going to different places in the world to study different forms of medicine and study different forms of food and healing. And that was pretty much my journey, and then kind of came back 360 and said, okay, now I want to teach this.
Oh, that curiosity just took you, that spark from that doctor's appointment, definitely a turning point of your life. And when your doctor said your test came back normal, this is the point that you realized that conventional medicine couldn't provide the answers for you. I can't imagine how frustrating that was for you. And you talked about, I know in hindsight now looking back, that was the start of your journey. And all of the doctors are, well-meaning, of course, but sometimes there are some limitations, and that's what we sometimes experience. Can you share with us a little bit more detail of that experience? That's a huge turning point of your life. I know if that didn't happen, right? Because that's a pivotal moment. You may not have become this person you are today if not for that experience. Can you share that a little bit more detail and how it drove you to becoming a naturopathic doctor today? Because you're amazing.
Oh, thank you. Thank you. Well, the first thing that I really want to say is with my medical doctor, her name was Dr. Sheikh. And I say that because I love her. She was great. She was wonderful at what she did. Had her as my doctor right up until she retired. I can't say a bad word about her. And she did everything that she could. And then just when I didn't have answers, I was like, I don't even know what to do, because I don't know how, like, she can't do anything because everything's coming up normal. But that's when I kind of started saying, okay, I'm not ill. I don't have a disease, but I'm not optimal. I'm not well. And then it was kind of like, I didn't have any answers of where to go, but it was my aunt who kind of said, hey, I have a naturopath. Why don't you see a naturopath? And I was like, I didn't know much about naturopaths then. I didn't know who they were. I didn't know how they were trained. I didn't know what they did, but I was just like, okay, if you tell me this is good. And so I went to see him, and I just had an open mind. And we actually ended up sharing a lot of information and having a lot of great discussions about learning and about nutrition in general, because there were some perspectives that I had that he hadn't heard of, and some that he had that I hadn't heard of, and of course there was a lot that he had that I hadn't heard of. So it sparked that passion. But the big thing for me was when I found out about the food sensitivities and when I started to apply them, my question was, number one, why didn't my doctor know about this? The bigger question, and now I understand why, medical doctors get at best half a semester of training. It's not what they do. It's not within their scope of practice. And we're putting too much pressure on medical doctors to expect them to be the answer to everything. They are wonderfully trained. They're great at what they do. But we need to work together as a team, because there are pieces of the puzzle that they're missing that naturopaths have, and there's pieces of the puzzle that naturopaths are missing that medical doctors have. So you need a team approach. It's not either or. We're not against each other. We're part of your health team. We're for your health. And so, but when I was thinking about that, I was thinking, wait a minute, I was just in an undergraduate degree program from a university that I have the utmost respect for. I still think they're amazing. I still think they're one of the best programs in North America for nutrition, and for the sciences, they're incredible. And yet, there were answers that naturopaths had that weren't being taught in an undergraduate degree of nutritional sciences and human nutrition. So I was like, well, if I know McDonald's is bad for me and I choose to eat it, that's okay. My body, my rules. I'm making the choice, and I have all of the responsibility on that. Great. My body, my rules. But if I don't know that McDonald's is harmful for me and I choose to eat it, well, now I don't have choice. You've taken away my choice and my power. And so with respect to that, that's what got me. I was like, okay, first of all, I don't want anybody to not know the information that's out there. I want everybody to have a health choice. I don't care what health choice you make, what food you choose to eat or not eat, what drink you choose to drink or not drink, as long as you know the consequences of what you're doing. Then it's your body, your rules. But if you don't know, that's when I get upset. Then people are taking away your power to choose, and that's not right.
I love that explanation with, in partnership with medical doctors. But my only issue with that too is when people right now who are struggling the way you did, and then they come to their doctor and say, hey, you're normal, you just sleep more. There are people like that right now, right?
Yeah.
And how do we, get to those people is the question.
Well, that's where people like yourself come in. And that's why I have so much respect for you. And when you invited me, I was so honored, and I jumped on it. In a heartbeat, I wanted to be here, because people like you are going to be getting people to know and understand, hey, there's another viewpoint that's out there, or there's another way of looking at things. What I love is, so I've now been in practice, believe it or not, for 23 years. It's 23 years this year. And so in that time frame, where I've seen the naturopathic profession go, and the acceptance of it and the knowledge of it has been really wonderful to see. When I first graduated, most of the people were like, I don't even know what you do. And I still get that a lot. Tell me about a naturopath. Are you like a herbalist or a homeopath? And what's the difference? And there's a lot of people who still don't know. But the information, what naturopaths have been saying, let's say probiotics and the gut microbiome. We've been talking about this for the last 20, 30, 40 years. Intermittent fasting, that's our stuff. And so now it's like, oh, this is, healthy, or the ketogenic way of eating. We've been talking about the ketogenic way of eating since the 1930s. So it's a thing. We've used it as a healing tool. So I think that the more people who get out there and talk about their experiences, number one, that's better. That's going to be great. The more you're going to inform the public. But also what I've seen is over time, as people start to have more experiences with naturopaths and hear more about it, we're really becoming mainstream now, and a lot of medical doctors know us, work with us, especially the younger medical doctors that are coming out. They've seen the research. They're like, okay, I know how you guys are medically trained. I get that you need to go to a medical college the way we do, or the way a chiropractor would. It's a 4-year postgraduate degree. So there's more acceptance coming out, and there's more of us working together all the time. And that's the way of the future.
The only reason why I say that, because I think that's where that spark came from, is there are other people like you who suffer, right? And now it took you to China studying this stuff. It took you all over the place just to understand how to really fuel our body, heal our bodies, both physically and mentally. That's great. You talked about when you changed your diet at that time, your health improved significantly, and this is one of your pivotal moments. So was it instantaneous? Did you see the effects of it right away? How long did it take for you to heal?
How long did it take for me to get relief of my symptoms versus how long it took me to heal are two different answers. Right? Because the fatigue that I was feeling, the chronic fatigue, the inflammation, the swelling, the foggy thinking, the kind of muscle aches and pains that I thought, oh, I must be just aging, right? Like, you're in your 20s, you're just aging. No, you don't have to, right? So all of those symptoms, they healed pretty quickly. It was within about 2 weeks. It was pretty dramatic turnaround. It was fast, the difference. But in terms of healing that and being able to reintroduce the foods that I was reacting to, that took a lot longer, because it's a process. And this is, I think, thank you for having this conversation, because this is something that a lot of people don't realize. They think, oh, if I have food sensitivities, most people who have looked into food sensitivities, they're going to know the classics: wheat, dairy, soy, corn. Right? So they'll pull those out. And usually I hear, especially with moms who have kids and they think their kids have a food sensitivity, so they're like, well, to be easy on them, I'll pull out dairy. Or, and if I see a change, great, and if I don't, then I'll add it back in. And then I'll pull out wheat. And they won't pull them out necessarily at the same time, and they don't necessarily see the changes, because sometimes they're introducing other foods that the child is reacting to, or they're now starting to eat more foods. Like, let's say they pull out gluten, but they increase the amount of corn that the child is eating. Well, guess what? Now you're going to see more of a sensitivity. But when you figure out the foods that you're reacting to and you pull them out, the body will then begin to heal itself. And there's a whole process that you can go through to actually find out what the underlying cause of the food sensitivities are, and then heal the body so that you can add those foods back in, because you shouldn't have to stay away from all foods for the rest of your life.
Here's the question for you, doctor. How do I know that I need to get a test? Because obviously there are symptoms, and based on your experience, what are some effective methods of detecting food sensitivities, so that I can be aware that I need to get this checked? If you can use some of the common symptoms that you have observed in the individuals with food sensitivities throughout your career, what are those symptoms?
Thank you for asking that, because I've had patients come into my office before and say, I've seen this test, I want to get it done. And the first thing that I do is I say, okay, let's back it up. Let's see if you need it. So there's a lot of people in our society, and I would probably say the majority of people in our society do have some sort of food sensitivities, just because of the fast-paced life we're living, how much stress we're under, we're eating on the go all the time, and then the quality of foods and what's being put in the foods that's considered okay and acceptable. And then some of the farming practices. So most people do, or a large majority of the people do. But does everybody? No. And so one of the things that you can do, I know I offer what I call a fireside chat. Most naturopaths, if you talk to them, they'll offer a little consultation that is complimentary. So you can just talk to them and say, hey, these are some of my symptoms. Do you think you can help? Do you think this test is kind of important? some of the symptoms that we can see in children, we can see dark circles under the eyes, runny nose, chronic ear infections, learning challenges, ADD, ADHD. When we're looking at adults, we can also see poor memory, focus, concentration, low energy, weight gain, bowel issues, skin issues, acne, psoriasis, eczema. PMS symptoms can sometimes be associated with that. So there's a wide variety of symptoms. And so if you start listing them off, everybody's going to be like, oh, that's me. So, but I think really talking to someone and getting a sense, like, number one, is it there? Is it worth doing? That's the important thing. And then even more important is to be able to work with someone who knows what to do with that information. Because again, the food sensitivities, if you do have them, which again, I think most people do, but if you do have them, they're a symptom. They're not a disease. So what do I mean by that? There's something else that caused them. So we talk about what some people call leaky gut or intestinal hyperpermeability, where foods are not being broken down properly, and then larger pieces are slipping through the intestinal tract into the bloodstream. And so when that happens, the body starts to say, hey, this isn't food. I don't recognize this. It must be a virus or a bacteria. So if you're eating a large amount of a particular food, your body's going to think it's under attack. And so that's when it starts amping up these different antibodies, this different part of the immune system. It's called IgG, immunoglobulin G. They start making these antibodies that we can measure to these foods. So, but if that's happening, it's happening for a reason. So if you just get the test results and the lab company will tell you things that are kind of mild you can have every once in a while, and things that are, really, really big, that's the ones you got to stay away from permanently. If you do that and you follow that, great, where's the healing? You haven't addressed the hyperpermeability of the intestinal tract. You haven't looked at the gut microbiome. You haven't said, hey, why did this happen? Because if you don't get rid of the underlying root cause, you're just going to develop sensitivities to other things.
Yes.
But if you address the root cause, well, guess what? Then your body can heal itself, and all foods eventually become okay.
Your approach is a personalized nutrition and lifestyle intervention to help individuals achieve optimal and peak performance. How does a holistic approach to help provide that better solution for everybody and addressing the unique needs while addressing their unique needs, Doc?
That's, I think, the really important thing. So a lot of times if you go to a medical doctor or a functional medicine practitioner, or even, some naturopaths, some chiropractors, they have like cookie cutter. Well, if you look at, again, the Canadian guidelines for nutrition, it's guidelines for everybody. Well, not everybody is the same. Everybody's needs are unique and different. And so if you take, male versus female, if you take young versus someone who's over the age of 30, versus, adolescent versus teen, we all have different requirements. And then given our lifestyle, how much stress we're under, what quality foods we have, whether we live in the city, which is more polluted, versus whether we live in the country, how much exercise do we do, how much downtime do we get, how much, again, perceived stress are we under. Everybody is different. And so to have someone sit down and take an assessment and say, okay, you're wondering, do I do plant-based? Do I do Mediterranean diet? Do I do keto? Right? What do I do? What's going to work for my body? Do I do paleo? Like everybody in the CrossFit community just jumps on paleo. They love it. And so what you're going to see is that there's not one way of eating that is right for everybody. And there's not one way of eating that is right for you as an individual for your entire life cycle. It's constantly changing and switching. And so to get that individualized approach kind of says, okay, let's cut out the noise. Instead of listening to what these health experts are telling you should be doing, how about we teach you to listen to your body? How about your body tells us?
Yeah.
And if you start listening to what your body's actually saying, what it wants, what it needs, what it's asking for, what is going to fuel it from the ground up and give it the building blocks it needs, you'd be amazed at what you can heal from.
I'm curious on what type of practices can we do to, because there's a lot of unconscious eating happening, right? Obviously, this world we live in today, they push snacking as healthy. You have to snack to boost your metabolism. Which is BS.
It's not for some people.
Mm-hmm.
Okay, because this is where I love taking a look at genetics too. You can look into the DNA, you can look at the genetics and find out, are you someone who needs to snack or not? And so for some people, snacking actually makes a difference and actually is what their body requires. But you're right, for other people, it doesn't. And so for some people, again, a ketogenic way of eating with intermittent fasting works really well. For others, it doesn't. And so, and the hormones play a piece in this too. So this is where I love talking to women who are doing a ketogenic way of eating. Because for some women, and couples in general, you've probably heard of these people. You have a couple who are a man and a woman who decide that they're going to do keto together. The keto couple, I call them. And the man shreds and begins to look like Adonis. And you can see him sculpting, right? You can see just his muscles like rippling out, the fat just melting off of him. He starts to get the six pack. It's fantastic. And the woman maybe loses a couple of pounds or actually gains and says, I hate him. And here's why. Because for women, our hormones want us, when we're of reproductive age, want us to become pregnant. That's their job. So if they're sensing in the environment that the body is under starvation, they're going to go, hey, you can't get pregnant. This is not a safe environment. So we're going to throw the hormone balance off. We're going to shut down the hormones. So this is why you see some women, when they get under severe stress, they'll actually stop menstruating. So our hormones respond very differently than men's hormones to the starvation hormones that can come out when you're intermittent fasting for too long of a period of time for women, or even when you're doing a ketogenic way of eating, you're increasing the ketones and you're affecting in a positive way in general the leptin and ghrelin levels, those hunger and satiety hormones. But if a woman is under a great deal of stress already and her hormones are out of balance, it's going to throw them more out of balance. And so you have to modify how you're doing the intermittent fasting to accommodate that. And for that particular keto couple, men, it is hormones. You're not allowed to say that. But you can say, okay, I think this isn't going to working for you. But when our hormones go off balance, when we are under stress or when we've been doing intermittent fasting and it's throwing the hormone balance off, we can get mean. It's so I've seen that experience before. So I would say, women, if you're part of that keto couple, oh my, or that's you. Just if you're getting snippy and irritable, just increase the carbs or decrease the intermittent fasting time. That's what's happening.
That's interesting. And to anyone who wants to get to learn more about that, there's the fireside chat, right, doctor?
Yeah, the fireside chat.
To learn more about that. And again, I want to get to, because I want to be able to listen to my body and get the chance to teach our listeners on how to listen to your body, because sometimes there are a lot of things going on, and listening to our bodies become so insignificant in our lives. And so how can we take the time to listen to our bodies first, and then second, what are the practices that we can take so that we're more in sync with our body, more in tune with our body, so that we can start listening?
Those are great questions. And I think one of the places to start is actually by doing a bit of fasting. And sometimes if you just take some time to do a cleanse or do a fast, whether it's an intermittent fast or I know a lot of people who are doing keto and a lot of people who advocate keto advocate actually taking 2 days every month to just do a little bit of fasting with some ketones and some water or some bone broth and ketones. And so if you do a couple of days of fasting and then start getting into clean eating, that can actually help to cut the noise. But what you have to think about is when you first start out, you're not really that much in tune. You think you are because you've got like these cravings that are happening, but it's not necessarily you that's craving it. There's physiology that's out of balance in your body. So by doing a little bit of a modified 2-day fast, or just clean eating, so cutting out those sugars, getting onto a ketogenic way of eating if that's what's right for your body, just doing something that is very cleansing, healing, and detoxifying for your body, maybe clean eating for a week. A lot of the times with my patients, I like to start them off with a cleansing way of eating for about 3 weeks. You'll start to get to understand at that point, when you start adding some of those foods back in, you'll start to understand your body much better. You'll hear it. And my patients give me feedback like, oh, when I eat this now, I feel awful. Or, if I go off, my body feels low energy or achy, or I notice it affects my moods and my health and well-being. So those are some of the things that you can do to start tuning in. And also recognizing, like, no forcing, no crunching. If you don't like a certain type of physical activity, for example, there are other types of physical activity you can do. So don't force yourself into doing something that you hate. I would say, talk to someone who can help you coach you through it so that you can learn to listen, because it's always hardest for us when we first start to see ourselves. But definitely make sure that, with everything that you're doing, you're saying, instead of listening to the noise that's out there, I want to hear what my body likes.
I'm curious, Dr. Val, what kind of health concerns and condition do you typically treat as a naturopathic doctor? What do you see often in your clinic?
Well, naturopaths in general, when I was graduating, there was this cute little saying that what we dealt with the most was the 3 Ps: poops, periods, and pain, which is kind of funny, but it kind of summarizes the naturopathic profession in general. So your irritable bowel syndrome, your SIBO, Crohn's, colitis being the constipation, diarrhea being the bowel aspect of things. And then, any type of hormonal imbalances, PMS, PMDD, any type of menopausal concerns, fertility, naturopaths generally work with those. And then any type of metabolic condition, really. So naturopaths can see people who have diabetes, heart disease, thyroid issues, autoimmune conditions, headaches, chronic fatigue, fibromyalgia. So there's a wide variety of health conditions. And truthfully, I think even I see a lot in my office, people who are high performers. They're living this high performance, fast paced life. Like myself, I like living like that. I don't want to compromise. I want to do everything that I can to stay as healthy as possible, as energetic as possible, as young as possible, as long as possible. And so I want to be in my late 90s, in my early hundreds. I still want to be able to windsurf if that's what I want to do. I want to be able to go for that walk. Yeah, so I think that's, for me, a lot of the people that I'm seeing now. Maybe they've started to have some weight come on, or maybe some aches and pains, or maybe their concentration isn't as sharp and they just need that focus and that drive. They're high performers and they just want more out of life and they don't want to compromise. So a lot of people I find have this thought that they have to age faster than is necessary. So you should have the energy, focus, concentration, and health generally in your 40s, 50s, 60s, even 70s, as you did when you were in your 20s and 30s. So those are the people that I like to work with. I like to work with, people who want that extra edge, elite athletes. I work with them as well.
Who doesn't want to be 20s again?
Exactly. With all the knowledge that you have now and experience that you
Yes.
have now. Yeah.
Yes.
Yeah.
That's great. I love that for people. That's just hope for people, right? Whenever you hear that, it's just, and plus you have, you came from your own struggles, and you just know, and I can hear this empathy from how you articulate yourself, and you just know and understand the other side of it, and that's huge for practitioners, and that's when you know that your practitioner really have that care for you. When I'm taking the time to understand what you're going through, and really tailoring this approach for one individual is something that not a lot of practitioners do. And I hope more and more people in your field become like yourself, and just giving that more compassionate service for people. Um, how how do you educate and empower your patients to take charge of their own health uh, after maybe after they are done with the program?
So I like constant learning and constant education. And so right now I'm working on getting more of the information that I've learned out in a book, putting together some learning modules and education modules as well. But definitely, it's always a learning opportunity. So you're never done. So I definitely encourage people to look at different practitioners that are out there to continue on their care and their journey. And I don't know that you ever necessarily stop with your health. You might not need to do something that is as intense as when we first start working together. But over time, having check-ins every 6 months, every year, just to kind of, and just constantly saying, okay, what can we improve on now? What type of cleanse can we do? And now what's going on with my body? Does it need to switch? Let's keep up with looking at what's happening in terms of, like you could go to your medical doctor and have a physical exam and your yearly blood work. You get that checkup and kind of say, where's everything at? And then now what do we do to move forward? So I think it's just a long process. And there are a lot of great resources out there for people, much like listening to podcasts like yourself, to get more information and education. And I would recommend some of my most successful patients actually just fell in love with this whole aspect of learning, and were constantly on different type of podcasts or listening to different types of podcasts on a daily basis, just to keep that learning and knowledge up. So that constant education and that constant quest for knowledge is, I think, a really important part of the journey.
This is not only educational for people who experience that same struggle, but this is also education for up and coming naturopathic doctors into learning how to really care for their patients in a much higher level. You are setting the bar high, and this is a much needed approach for people, because like I said, like yourself, when you struggle, if not for your naturopathic doctor back then, who knows what maybe could have happened, because you weren't aware of that area of health and healing. And just glad for people listening on the show today, because you get to learn more about how to heal your body the right way, when again, there's certain limitations in different fields of health, and this is one of the ways that you can really heal your body naturally through services like Dr. Val's clinic here in Toronto. Dr. Val, where can people find you?
Definitely on my website, drvalfranc.com, and doctor is Dr. Then it's VALFRANC.com. And that's probably the best place. So I have a nice website. You can book a fireside chat. You can give us a call, and my wonderful virtual assistant will get back to you and help you with all your needs.
Awesome, Dr. Val. Thank you so much for coming on and sharing your story here today, guys. Everything will be linked down in the description box below if you want to check out Dr. Val. Again, Dr. Val, I appreciate you coming on.
Thank you so much. I appreciate the invitation. It's been so much fun.
Thanks, Dr. Val. All right. See ya. Bye.
Bye.